Welcome back to Mom and Mind. I'm your host, Dr. Kat. On this episode, I am joined by Dr. Parditi Mehra. She is the founder and CEO of HappiNest, India's first dedicated platform for parental mental health. With close to a decade of experience in health tech and public health innovation, she has led digital health solutions that improve access to healthcare for all. After experiencing firsthand the lack of awareness and support for maternal mental health in India, she founded HappiNest to bridge this gap, ensuring that every mother can access the care she deserves. She works at the intersection of healthcare, technology, and community to ensure a happy start to parenthood for all. Now, in this episode, she is sharing some of her personal journey. We're talking about stigma and the role of culture in perinatal mental health and why she founded HappiNest. This kind of work that she's doing is part of the innovation that is needed everywhere, all around the world, especially in places where resources don't exist. And these are things that are hard to do, hard to start up. But it definitely takes somebody who is dedicated and has a vision and has this desire to bring it forth and being connected with the resources to pull this together is huge. I'm really happy for you all to hear about the work that she is doing in India. Welcome, Dr. Mehra. I'm so happy that you're here with us.
Thank you, Dr. Kat. Thank you for having me here.
Oh, I'm excited that you're here for multiple reasons, but one of them is that you are in India and you're the first guest I've had on who's in India that I've been able to speak with. So, about where in India are you?
Yeah, Dr. Kat. So I am from Bangalore. That's in India. That's, let's say, in the southern part of the India. And it's also called the Silicon Valley of the country.
Ah, there you go. Amazing. Thank you for that. Yeah, I'm the other reason I'm excited that you're here is because you're doing really groundbreaking work in India. And I definitely want to get to that. But first, I would love for you to let us know how you got to where you're at now with your story, wherever you'd like to start.
Yeah. So let me start with this. Let me start from a little bit of my background. So I studied to be a dentist, but post that I did an MBA and then I got into healthcare technology.
Mm.
So for about 10 years, I was designing healthcare programs, healthcare projects. I was working with multiple startups in the country in the space of digital health. So all that was going great. And then at some point, I conceived. It was a planned pregnancy. So everything was great. I had an amazing job. I had amazing family support. So all that was going great. But right from the time I conceived, there was something off with how I felt about the whole thing. Physically, I had an amazing pregnancy. There was minimum nausea. I had very little physical symptoms. So it was great. I could enjoy all of the 9 months. But right from the first month, right from the time I got to know that I'm pregnant, there was something or the other that kept worrying me. I just couldn't put a finger on why this was happening.
Uh-huh.
For the first 3 months, I was very worried about whether I'll be able to take this to full term. I was 31, 32 when I conceived. I could conceive very naturally. But even after all of that, I was, for some reason, scared all the time that something off is going to happen. So, yeah, come back to this point, but the pregnancy happened. Everything was okay, except for my mental state, where I didn't really felt like celebrating for some reason. I was too scared to celebrate
Yeah.
up until the very last moment. It was all going great, but it was somewhere in my 8th month, I went for a usual checkup. And the doctor said that they'll have to do an emergency C section because the amniotic fluid had gone very low.
Oh.
So there was some threat involved. And that again, since I was already very worried about whether the baby is going to be healthy or not, will things remain same or not? What about my career? There were so many other questions which I think every mother goes through. But for me, it was a little more. But I never thought that there was something off about it. I thought, okay, maybe this is how it is for everyone and all be okay after I deliver. So that's the usual mentality that once you're done with pregnancy, that's the hard part. Everything is going to be okay after delivery. But yeah, so I delivered the baby. The baby was healthy for even after that. Somehow I just wasn't happy. I just wasn't at peace because I kept thinking till all the tests were done that is everything all right with him? Is there something off? I checked all the reports. Since I come from medical background,
Right.
I was very concerned and very worried about the health of my baby, and I checked all of the reports myself. And then, yeah, everything was okay, the initial test, and we got the baby home. Now, immediately after we got him home, I just felt as if I had walked into a parallel universe where
Oh, wow.
everything was same, yet it was so different. I just vividly remember that moment that with the baby, I just didn't know, okay, where should I sit? What should I do with the
Right.
baby? It just didn't feel familiar, my own house. And
Yeah.
it did take some time for me to accept that fact that, okay, the baby is here, everything is all right. You
Right.
can now drop your guard, be happy, celebrate the fact that everything has gone well for you. Yeah, that happened. And all this time, like I mentioned, I had a great support system. I have a very loving partner. Till date, he's very supportive. And especially
Mm,
during that time, he equally took part in taking care of the child. I
great.
had my mom there to support me.
Mm,
I had a hired help. Everything was there. So it wasn't
mhm.
that I was alone or something of that sort. But then again, I just, for a long time, couldn't accept the fact that things have changed
Yeah.
and that this was my happy place.
Mm,
Somehow, for a long time, I longed to go back to my older self. I felt
mhm.
very restricted with the baby.
Yeah.
There were challenges with breastfeeding,
Mm,
but there was, of course, sleep deprivation for many months
right.
together. I had a very difficult breastfeeding journey, so
Mm,
I had to then pump milk regularly.
it's a lot of
A,
work.
yeah, that's a lot of work
Mhm.
along with caring for a baby. So while all of that was going on, I also did not feel fully connected to the baby.
Mm,
All this while, I had been really waiting for him to come and to celebrate that moment. But then when he finally came and everything was all right, but still I felt very distant from
uh-huh.
him. I just
Right.
felt that my life has changed so much. I just couldn't
Right.
accept that transition. I
Right.
felt I also started feeling very distant in my own relationship because there
Mm,
was, literally no time for each other. All we
right.
were doing was caring for the baby, putting him to sleep, feeding him,
Mhm.
and everything, the entire routine, our entire life was around the baby. And nobody had prepared us for that, honestly.
Right.
In my family, I am the eldest. So
Mhm.
my baby was the first. I didn't handle any
Oh,
babies before. So probably all of these small things, they started adding up. And while they say that there's something called as baby blues, but for me, the symptoms were much more severe.
uh-huh.
And they also
Um,
lasted a very long time,
starting in pregnancy
starting in pregnancy. So that's
and
only
getting
later
worse. Yeah.
and getting worse. So I only later realized that I did go through perinatal anxiety and I also went through postpartum depression.
Mm,
For a long time, when I was going through, I just felt that it was me.
mm,
I just felt that maybe I wasn't ready to be a mother. Maybe it was a bad decision to bring
mm,
this child into the world. And it was a very isolating experience because nobody, like I said, for 9 years, 10 years, I was in healthcare. I was
mhm.
designing programs for pregnancy and programs for healthcare, but never once had someone told me about this. Yes, I knew that there's something called as postpartum depression. Everybody hears about it. But when it actually happened, at least for the initial few months, I never could think that, okay, it's not me.
Right.
There's a reason why this is happening. All of the negative thoughts,
Yeah.
all of all the things that were going on in my mind, I just kept blaming myself. I just, of course, that I loved my child. It's not that I didn't. Even when I'm
Mhm.
saying that I felt distant,
Right.
if anything would happen to the baby, I would just feel so worried that no,
Yes.
everything should be okay with him.
Yeah.
But still, for many months, I would say the first 3 months were very difficult. That's, I think, true for all women.
Yeah.
Uh,
It's pretty rough.
yes. And so I thought, okay, it'll be all okay, because people said, okay, the first few months are difficult. By 6 months, it'll be okay. I waited for 6 months. At 6 months, I joined back work. That was a little bit of a relief, because there was something other than the baby. I longed for adult interactions. I longed for meeting other people, meeting
Right.
someone other than the baby.
Yeah,
So
right.
there was some relief when I joined back work at 6 months. But these feelings, that that feeling low, feeling lonely, just not being able to see yourself as a mom,
Yeah.
that just didn't go away for a very long time.
Did anybody at that time happen to notice any changes in you or have any concern? And were you sharing them?
So I think people did notice that I was acting a little off. My own mother and, of course, my partner, since they were very close and we were staying in the same house, they did notice that something was off, and they gave me that space that, okay, maybe she's just adjusting to motherhood. I used to get very angry, very frustrated with the drop of a hat. If
Yeah.
things were not done
Mhm.
my way, I would just create a big scene. I would cry for no reason.
Mm.
And while it was okay for the first few months, my mom was there for 3 months with me, and she understood some bit of it, but probably even for her, it was difficult to understand why am I finding this transition
Mm. Mm.
so difficult. Yes, there are certain challenges, but then at some point, I think that even she didn't understand what was going on.
Sure. If you have, obviously, you have some medical knowledge and this kind of understanding that postpartum depression is a thing, but culturally, what you can't speak for everybody and every culture within India, but is there like a general kind of idea that postpartum depression exists, or is it known about that kind of stuff?
In India, people do know that there's a term called postpartum depression.
Mm.
And of late, I've been noticing that people are also using it a lot,
Mm.
even when it is not postpartum depression.
Uh-huh.
So I'll try to explain that more completely. Again, to go back to your question, do people know about it? Have they heard about it? So probably they've heard about it because some celebrities are talking about it and
Oh,
there
okay.
are some discussions about it. But do women know how it feels, or where should they go for support if they feel like this? What are the signs and symptoms? Probably not.
We still have so far to go.
Exactly. So
Yeah.
that's it. That's what I was trying to say, that while I knew that there's a term that
Mm,
exists for
mm,
it, but I didn't know that all of these feelings that I'm feeling, this is what postpartum depression looks
mm,
like.
mm.
And going back to your question on were there people noticing it, so my partner noticed it, and he really pushed me to go out and get some support, because
Mm.
he said that, see, I can see that you are really struggling, and this is not helping you, this is not helping the baby, and this is also not helping us. But I kept resisting the idea, because again, going back to culture,
Mm.
and this is true for all cultures, but particularly in India, mothers are seen as this, they have this sacred role. Becoming a mother is such a glorified experience that you can, everybody expects you to be nothing but happy.
Uh-huh. Yes.
So when that happened, I just couldn't gather the courage to, number one, say that, yes, I'm struggling and I need support and I don't see myself as a mother.
That goes against what you're quote unquote supposed to feel
Exactly.
and do and how behave, all of that. Oof.
Right.
Yeah, that is a tough one because it's so internalized, our lessons from our surroundings, our culture, our beliefs, and to be at odds with that within yourself, let alone tell somebody about it, is incredibly difficult.
Absolutely.
Yeah. So, with that feeling of resistance, I'm so glad that your husband noticed that and supported you to do something about it. But how long did it take to get help, or did you seek help? How did that happen?
Yeah. Unfortunately, I didn't take any professional support, because, like I said, I just found, since there was no conditioning, there was never a mention of this. And I even spoke to my gynecologist. I spoke to a few other people in the healthcare system. Again, for them also, it was like that, "Hey, maybe this is baby blues. Okay, try meditating, try to eat good food, try to do something simple, and then it should be okay with time." But then I did not have, again, the courage to go out and seek professional support. Also in India, there are this, that's one of the reasons why happiness exists, is that today there are a handful of people practicing perinatal mental health. Yes,
Amazing.
there are
Amazing.
therapists. Yes, there are therapists, there are psychiatrists, but people who are trained in reproductive health, people who are trained in perinatal mental health, you could literally count them on your fingers.
Ah, that's tough.
So access is also a big issue here.
Right.
What I instead did was, this is also after a lot of resistance. So I vividly remember one day, it was a simple, I think it was a Saturday or Sunday. The three of us, me, my baby, and my husband, we were sitting. And I was still feeling low. This was around when my baby was 10 months old.
Mm.
And I just said that I don't know why I don't feel happy when this is supposed to be my happiness. And that feeling, that do I have to live with that feeling all my life? This is what is supposed to be the happy place. Why am I not happy? That I had to deal with that feeling for a long time. And then, I mean, just off the hand, my husband mentioned that you are probably too hung up on the past. Till the time you accept that life has changed and you start seeing yourself here with the baby and you start seeing us here as a family, I don't think you will be able to see yourself or see
Mhm.
this as a happy place. And fortunately or unfortunately, this is what you have now.
Uh-huh.
And for him, it was a very casual comment, like all husbands.
It is what it is. So, yeah.
It is what it is, right? But for me, it was a turning point because I suddenly realized that he was right. And I have to stop thinking about my past. I have to stop, resisting this idea that life has changed, that yes, there are going to be limitations, but now I have to look forward and see how do I plan my life and how do I start enjoying with the baby.
That's
So
a major shift.
exactly. And with that, then I started working on my own journey, self discovery journey. I started reading a lot. I started reading whatever resources were available on postpartum support or postpartum changes, what to expect, mentally, what kind of things to expect. I started reading a lot of books. And one most important thing I did was to reach out to a childhood friend.
Mm.
She had become a mom just a year before me, and I was always in touch with her. It's not that I was not talking to her all these months, but we used to talk about very practical problems that, okay, breastfeeding is not working out, this is not working out, schedules are disturbed. But that was the first time when I gathered the courage to open up to someone outside my family and say that, hey, this is what I'm feeling. Is this normal? The idea was that maybe she'll have some solution or she'll point me to the right person, given that she's a mother and she'll probably have a little more knowledge than me. And so that was the first time that she validated those feelings and she said, I have been through it too.
Oh, wow. Yeah.
And just that one statement
Hmm.
put me at so much comfort,
Right.
me a lot of peace. And that is the first time I realized that, oh, okay, it's normal then. She had it. If I am having it, probably there are others out there who are having it.
All
And
right.
during this process, I was also, like I said, researching about what kind of support options are there, what's available in India. Why didn't people prepare me for this?
Right.
So I think that's where, for me, things started to improve. It obviously took some time. It took a couple of months. I would say by the time probably my child was 18 months old, that's when I started feeling happy, comfortable, and like myself again. And that time also coincided with the birth of HappiNest.
Yeah. How did HappiNest come about as an I can imagine with what the trajectory is, but What were you seeing in your research and feeling within yourself that helped you to fill this gap with
Right.
happiness? Yeah.
So yeah, like I mentioned, I delivered with one of the leading chains here in India, leading birthing chains here in India, with probably one of the best doctors of the country. In spite of that, none of the antenatal checkups here screened me for any mental health. I now know that there are protocols outside the country. Let's say in Australia, I know some of the places even in the US, where all of the antenatal checkups must have one or the other mental health screening,
Mhm.
right? But then there was not one checkup that screened me for any mental health changes during pregnancy nor after.
Mhm.
So I think, and while there was a lot of focus on physical health, in my own pregnancy package, I had access to lactation consultants, I had access to nutritionists, I even had access to physiotherapist. There was no education, no counseling, none of it about what to expect. There was no mention of any kind of mental health changes that you could expect because, and it's surprising now, only now I know that 80% of women in India go through postpartum blues, baby blues.
Mhm.
Around 22% of them suffer with postpartum depression.
It's a lot.
In That's a lot. In spite of having such high numbers, it's very surprising why there's no discussion, there's no screening, nothing whatsoever on what you should expect, or these are some of the things, these are some of the mental health changes, this is how you may feel, this is normal, this is not normal.
Right.
So, again, through all of the research and understanding what other countries are doing and then, how it works there, that's when I realized that there's a huge gap here. In India, there are, I may be wrong with the numbers, but there are more than 500 mental health startups in the country. But there is not one startup that is focusing on maternal mental health,
Until
right?
you came along.
Until happiness came along, yes.
Uh-huh.
And the mothers that we've spoken to, like I said, that taking therapy, taking professional support, going to a psychiatrist, it feels very loaded, right?
Sure.
For a mother to go to a traditional mental health platform to get treated for depression, it's a big step, right? It needs a lot of courage. And it was surprising. With these numbers, there's no one doing this. Of course, now I realize why nobody was doing it because it's a very difficult thing to do. And unless you understand this completely, it's very difficult to do it, right?
Of course. I'm just imagining you both have to say, hey, this resource is available. We've created this, I've created this. But in order to get people to know that they need it or that they could benefit from it, you have to do, I imagine, a lot of outreach, a lot of education, a lot of explaining, a lot of breaking through stigma or maybe even misunderstanding about what this is. That's,
Absolutely.
yeah, a lot of
I mean,
effort.
it's a lot of effort. HappiNest probably has now existed for an year and a half. And it is only now that we are seeing a good uptake by mothers. But even today, most of our efforts are, what in business terms we call it B2C, where mothers are searching for help related to postpartum depression and then they are seeing happiness and they are coming up for it. Talking about the problems that you mentioned, because of all of the stigma and the taboo attached to it, I have been trying to partner with healthcare providers. I've been trying to partner with hospitals that, see, I understand that you can't do it, but let me do this, outsource
Yeah,
this to you.
yeah.
But you won't believe that a lot of people, number one, here are still dismissive of this issue.
Ah, sure.
That, oh, this only happens with, I remember one doctor saying it, that this only happens with ladies like you, who are headstrong and they find the
Oh,
transition very difficult. And,
okay.
my clientele, they are all ready for motherhood. So I was like, great, good for you.
Wow. Also, maybe not.
Yeah, yeah. And
Wow.
then there's, I mean, that some people have candidly also shared this, that when they have tried to refer a person, refer a mom, to a psychiatrist or a counselor. Because in India, mostly what happens is the mother usually doesn't go alone for any kind of antenatal or postnatal checkups. It is one of the family members. It will either be a partner or, let's say, mother-in-law or whoever is there to take care. So usually the family tags along. Now, in front of the family, I've heard people say that whenever we have tried to refer a patient, the family often decides to change the doctor
Ah,
because there's nothing wrong with
oh,
her.
sure.
There's probably something off with you, but nothing
Mhm.
could be wrong with her.
Right,
She's
right.
becoming a mom or she has
Mhm.
become a mom. How could she be depressed?
Okay, there's multiple things happening in there. One is like everybody doesn't have all the information, but there is also almost sounds like there's something protective,
Yes.
like they're wanting to protect her and at the same time as like not wanting her to have anything be wrong with her.
Yeah, you could call it that. Or you could. So basically, in India, mental health is still seen with a lot of stigma. Normally, if someone says that they are taking therapy or they are depressed,
Just in
in,
general.
in general, yeah,
Uh-huh.
it's difficult to admit here.
Mm,
When it comes to maternal mental health,
yeah.
there's the stigma is 10x probably.
For sure 10x, yeah.
Yeah. So for a mother to say that, hey, I'm depressed, I'm not feeling happy after becoming a mom, it's a very difficult place to be in.
So she can't necessarily have just a one-on-one conversation or without a family member being present or knowing about what's happening. I can see how that could make things difficult.
Yeah. So
So,
that's where, yeah, sorry, go ahead.
yeah, I wanted to step back a little bit and give a broad view of what happiness is.
Sure. So HappiNest is basically a platform where we care for the emotional well-being of parents right from the time they start planning a family to early years of parenthood.
Mhm.
So here today we are talking mostly about postpartum, but maternal mental health or perinatal mental health is much more broader than that. People who may be struggling with conception, people who may actually even before that, people who may not be sure whether they want to have kids or not. There is this growing trend of TINK, double income, no kids, even here
Mhm.
in India, right?
Double
So,
income, no kids. Oh, okay. I hear it. Think. Got it. If I have heard that before, but I definitely forgot.
yeah.
Mm,
So people are still not sure whether, number one, the marriages are happening late, and then they are not sure whether they want to have kids or not because
mm,
they don't see themselves as parents and taking on that responsibility.
mhm,
So there's a lot of invisible load attached to it. And then at some point they realize that, oh, yes, they want to become parents, but then probably it's too late. And then they
mm.
have to probably go through assisted reproduction.
Oh,
And that takes a lot of toll,
it
right?
does. Yeah.
And then, yes, pregnancy has its own challenges and postpartum, early years, everything. So that's what happiness is all about, caring for your emotional well being during this entire period.
Mhm,
Mostly work on two aspects. We not only work on supporting or correcting if there are symptoms present, but we also want to do a lot of prevention and awareness.
nice. Yeah.
So that's where we work with expecting parents to psychoeducate them, to give them an idea about what to expect. It's
Mhm,
normal, when to seek support, the role of the partner, the role of the family. So
mhm,
we have programs around prevention. And of course, then we have programs for correction. So if a mother or even an expecting mom is feeling off, is already showing signs of anxiety, depression, or any kind of mental health changes where she needs support, so we also have support for it.
that's
That's
good.
what happiness is all about. And the idea is not only to provide therapy, but it is more holistic approach. Because till date, I feel that probably not all moms need therapy. Therapy in general is a great concept. And
Mhm.
as an individual, whether you're depressed or not, I think everybody in today's day needs therapy because there's so much going on.
Much. Yeah.
So that is helpful. But for mothers who are already stretched for time, going for therapy sessions probably is not required for everyone. So what we do is we don't really directly send them to therapist. What we do is we have the first free discovery call, which is usually with another mom who has gone
Mhm.
through some experiences and has been trained to identify, to triage.
Right,
So
right.
we work on triaging what's mild, what's moderate, what can improve with just a little bit of support, validation, venting, and what will require actual professional support. So through that process, we triage, and then only if someone, let's say, has moderate to severe symptoms, that is when the mom is sent for professional support, and we connect them to perinatal counselors and psychiatrists.
And is this primarily online?
Yes,
All on.
and that has been very helpful.
Yeah,
Because again,
for
for a
sure.
mom to take
Yeah.
time and
Yes, yes.
go for appointments. And like I said, again, in India, for a mom, there are cultures which restrict you from going out for almost 40 days after delivery. So you just can't step out. Even after 40 days, there's so much to do, you just can't step out. So that online thing has been very useful. A lot of moms today who are taking support are also taking it privately. Many of them probably have partner support. Many of them have not even told their partners that they are seeking support.
So it helps for it to be online
Yeah.
even more. I'm curious about how it works in India. In the US, like for me, I'm licensed in California, so that's the only place I can help anybody is in this state. But with an online platform, there could be other people. There's a lot of therapists, other people in other states can help mothers, whatever partners in that state. How does it work in India? Can you reach everybody with your platform, or is it limited to certain locations or states, if you will?
Yeah, so the licensing here, so there's something called as RCI registration. So once you complete your master's and then there's a degree called MPhil here, you can register yourself as a clinical psychologist and get the license. And that license is valid for to practice in the entire country.
Oh, great.
So that ways, yes, there's this flexibility where we can offer support to anyone residing in any part of the country.
Oh, that's amazing. Oh, and it's a huge country. So there's and imagine just getting the word out about your resource in and of itself to just as far and as wide as possible is a big part of what you're trying to do.
Absolutely, yeah.
Well, how are people responding? Like people who are coming in for help or finding your resource, what kind of feedback are you hearing?
So the feedback has been really wonderful. Most people who have taken support are very thankful that they found happiness and that we are doing this work that no one else is doing. The kind of response I get, I sometimes get very emotional messages from them saying that thank you for doing what you are doing. And in fact, we have something called as a volunteer program. So most of the moms who've taken support from us register themselves as volunteers so that they can give back to the society
Oh,
or they
that's
can.
amazing. That's amazing.
So yeah, the support that we are receiving, the feedback that we are receiving is amazing. Yes, we haven't been able to reach a lot of mothers right now, but we are slowly building. And yeah, whoever we have reached out and whoever we have supported, they are very grateful for what we've done.
And it's the fact that they're coming back, or a lot of people who are able to coming back and volunteering, that peer level
Yes.
support that you provide. It sounds like the discovery call. Is that
Mhm.
what, yeah, to be able to talk to somebody. If I were a mom not knowing my way through this, to be able to talk to somebody who I already know or can know that understands what I'm saying is huge. It breaks down in your conversation with your friend is the perfect example. It just breaks down barriers, or not that you're not still vulnerable, but it allows a pathway to start to heal.
Absolutely. And just that validation from someone who
Hmm.
is been through a similar experience, it means a lot. I have moms who say that we just want to speak to you. I'm also a peer supporter. So there are moms who say that just speaking to you was so helpful that we just want to keep coming back and talking to you.
Oh,
So
that's
it's sometimes
amazing.
what also helps is not everyone is ready for therapy as the first as
True.
the first mode of support. So these peer sessions also help to break down those barriers, to help them understand how therapy is going to help. And there's nothing wrong, talking to a counselor, talking to a therapist. And of course, like I said, just talking to another mom and just talking to someone else who says that yes, this is all okay, and there's you're not the only one on the earth. That's a huge relief in itself.
It's so powerful. So, from all of the work that you've been doing and what you've seen and the feedback, and what do you think needs to change in India or in order to get help to as many people as possible?
Yeah. So one thing here I would like to start by saying is that when I started Happiness, I saw perinatal mental health from a pure clinical lens, lifestyle changes, social structure changes, etc. But working with moms for over a year now, that thing has completely changed my understanding. And now talking to all these moms, I understand that these struggles, while for a lot of moms these may be internal. For instance, with me, it was purely clinical, right? I had just to, but unfortunately, wait 5 minutes now. 5 minutes. No, 5 minutes now. Okay, done. Done. 5 minutes. 5 minutes. Wait to 5 minutes. Promise. Promise. I think that's enough. He's saying, but
Got it.
I'll start that again.
Okay.
Yeah. Can you hear him crying and all that? Is that getting
I
recorded?
can't.
Okay. So I'll try and wrap this up quickly. So yeah, when I started Happiness, I saw perinatal mental health from a very clinical lens that, okay, hormones get disturbed, there are lifestyle changes, there's this transition that you not just do, which is why this happens. But working with Indian moms for past 1.5 year, that perspective has totally changed now. In India, many mothers are still dealing with pressures to have a boy child. Many others are forced to give up their job because the family doesn't support their returning to work after having a baby.
Oh,
Some of them who are still living in the joint family are raising their kids alone or meet all by themselves because of the gender roles that exist here. Again, says I don't want to generalize it to all moms. Of course, there are some amazing families and amazing people out there. A lot of people who have come to us for support have raised these concerns, and this is one of the reasons why they are feeling the additional pressure. Yeah, going back to the question of what needs to change, is the, number one, women need all the women. They need to be encouraged to share their struggles without the fear of judgment.
mm,
And for that, I think the families need to be educated first. Women today tries to say that I am depressed or I'm not feeling like myself after becoming a mom. Instead of saying that, oh, it'll be all okay with time, there needs to be some education for the partner, for the family members, to make them understand what's normal, what is not, and
right.
then how to help the new mom. Besides that, we need to normalize conversations about maternal mental health through your platform, through some other amazing platforms. We need to start talking more about these experiences that moms are having.
Right.
And instead of just one or two people talking about it, we need to have many moms come up and say that, yes, we face this too, and this is completely normal,
Right.
and it's okay to seek support. And yeah, seeking therapy, seeking counseling, it shouldn't be seen as any kind of a weakness, but something that is going to help both the mom and the child. I remember reading one of the books during my early time where it mentioned the effect of early caregiving on
Mhm.
how what's the effect of how the child is being raised or treated in the early days, how his worldly view is shaped. Those early days, the early caregiving experience, that really shapes up the child's worldview and the sets the stage for his adolescence.
Right.
So I think that is very important for moms and families to understand that taking care of your own mental health, your own emotional health is not only beneficial for yourself,
Right.
but also baby.
Absolutely. Yeah.
Yeah, I think with that, I would like to say that there needs to be a lot more conversation about this. And thanks for giving me this opportunity to share my story and the work we are doing with Happiness.
Absolutely. I'm so glad to have you on, and I want everybody to share this and try and help and support you in whatever way possible to get this out. And even if you're just sharing it with one person who could benefit from it or a family member, either in India or here in the US, wherever, that can help spread the word, that would be amazing. It's awesome what you're doing. and so needed. And just thank you for sharing everything with us.
Thank you. Thank you so much, Dr. Kat, for having me here. It was a pleasure and honored to be on your podcast.
To learn more, go to happinest.life. That's HappiNest.life. And please do share this resource. Let people know that this exists. It is vital that we are spreading information and sharing this. And it's just as easy as saying, hey, I heard about this new service or this website in India called HappiNest. Go check it out. Um, sometimes when we're thinking about how to share information with people who may be having a perinatal mental health condition, it can feel hard or difficult, or we don't know what to say. But if you're just sharing information and kind of letting it be at that, it can be a useful way to pass along a resource without even knowing necessarily how to talk to somebody about what's going on for their perinatal mental health. Thank you so much for being here and listening into this conversation. Until next time.